This is Mark. Mark is a carpenter who lives with his wife and 2 grown daughters in Squamish. A few years ago, Mark was diagnosed with bladder cancer. His chemotherapy treatment at the BC Cancer Agency was successful, and for the past 2 years, his cancer has been in remission. Lately, Mark's back has been giving him trouble. Today, it hurts a lot more than usual, so he goes to emergency.
Mark, I'm just registering you in the clinical information system. This barcoded wristband is your patient ID. Take that bed over there and a nurse will be with you in a few minutes.
Hi, Mark. I'm your nurse, Hussein.
Hussein does a quick triage and makes notes in the patient record.
I see you were treated for bladder cancer a couple of years ago. Is that right?
Yes, but that's all in the past. It's my back that's bothering me today.
Okay, let's find out about this back problem. Your medication history says you're not taking any current prescriptions. Are you taking anything right now for pain or for any other reason?
Yes, I took some ibuprofen before I came in today.
Hussein asks Mark a series of questions, takes his vital signs, and records it all in the electronic record. Dr. Kirshner is an ED physician at Squamish General Hospital. Before seeing Mark, she reviews his chart and the notes made by Hussein. She can do this while Hussein is still using the chart. She also sees details of Mark's past treatment for bladder cancer. And she notes that he is on follow-up for a clinical trial study relating to his bladder cancer.
Mark, I can see from your chart that your back's giving you trouble.
Dr. Kirshner confirms details about Mark's past medical history by clicking through his electronic record. She then proceeds to examine Mark.
Okay, Mark, I think your problem is probably muscular, but because you have a history of bladder cancer, I want to make sure there isn't anything else going on. So I'm going to order an x-ray of your lower back.
Dr. Kirshner uses the system to order a lumbar spine x-ray. Mark is still in pain, so she orders him some stronger painkillers. First, she checks the electronic record that Mark has no drug allergies and confirms that with him. She uses the system to order routine blood work and order Tylenol 3. Her order entry instantly alerts a staff pharmacist who reviews and verifies the order.
I'll let you know as soon as we get the results. If you need anything, just ask Hussein.
She then documents her findings and actions using front-end speech recognition. Hussein sees Mark's verified medication order appear in the system. He signs in to the Omnicell automated dispensing cabinet with a fingerprint scan. He finds Mark's name on the Omnicell screen and selects Tylenol 3. A flashing light indicates the correct drawer. He takes it out and signs out of the Omnicell. Hussein scans the barcodes on Mark's wristband and the medication to confirm they match the order that's been entered in the system. He then updates the electronic medication administration record. A lab tech comes to take a blood sample from Mark and labels it with a pre-printed barcoded label. Suniti, a radiology technician, sees the order for Mark's x-ray appear in her view of the system. The order automatically generates a barcode label. A paper requisition is also printed out automatically. A porter takes Mark for his x-ray. Dr. Kirshner can see on her screen that Mark's blood work results are in, and she reviews them. They are normal. Hussein and Dr. Kirshner can both see when Mark's x-ray results are ready by looking at their own view of the system or at the ED tracking board. Dr. Kirshner can review the x-ray without logging into a separate system. The x-ray shows some slight irregularities in the lumbar spine. She thinks his cancer might have metastasized to his bones. She calls the BC Cancer Agency oncologist, Dr. Young, who has an upcoming appointment to see Mark.
Hello, Dr. Kirshner. I reviewed Mark's x-ray and I agree that he needs further investigation. I'll arrange a CAT scan and PET scan to be done at BC Cancer and arrange to see him after the scans have been done.
Mark, we've got your x-ray back. Here, take a look. We need to rule out whether your cancer has returned, so we need to do some more tests. I've talked to your oncologist, Dr. Young. He's booking some scans to be done at the BC Cancer Agency. He'll see you after.
At the same time, Dr. Young uses the clinical information system to request scans for Mark at BC Cancer's Vancouver Centre. The request goes directly into the scheduling queue.
Mark, I'd like you to visit your GP soon so he can help you manage your back pain if it doesn't settle. In the meantime, here's a prescription for some more Tylenol 3 that you can fill at your local pharmacy.
She enters a discharge order in his electronic record.
That's all for now, Mark. Hussein will come and finish your discharge. I know you're concerned, but let's hope the scans show nothing to worry about.
You and me both, but I'm really glad I came to the hospital.
Dr. Kirshner completes her notes in Mark's electronic patient record using front-end speech recognition.
Okay, Mark, we're about to discharge you. Did Dr. Kirshner say she'd like you to visit your GP?
Yes.
Great. I can see that your oncologist has requested scans. Someone from BC Cancer will call you to make the appointments. I'll take your vitals one last time, and then I'll complete your discharge documentation and you'll be good to go. Here's the summary of your visit. Do you have any questions? Anything you need to know before you go?
No, I'm good. Thanks for everything.
The next day, Mark visits his GP, Dr. Wong, who has already received Dr. Kirshner's ED note electronically. Dr. Wong has all the information he needs to make informed clinical decisions with his patient. At BC Cancer's Vancouver Centre, a scheduling clerk reviews the scan request from Dr. Young and calls Mark to notify him of the appointment. After getting his scans done, Mark meets with Dr. Young to discuss the results. Mark is anxious but hopeful. He knows he's in good hands. This look at the future was brought to you by the Clinical and Systems Transformation. Our path to smarter, seamless care.